Currently, over 80% of COVID patients in Malaysia are quarantined at home. The government, through the COVID Evaluation Center, is monitoring their conditions remotely. If needed, the center will then send an ambulance for the patient to receive treatment at the hospital or quarantine center.
As of September 2021, there have been over 2 million confirmed COVID-19 cases in Malaysia, with more than 170,000 active cases. Among them, 80% are quarantined at home, which means the involvement of nearly 150,000 people. Since January of this year, the hospitals and the quarantine centers are overcapacitated. Thus, the Ministry of Health and Welfare deemed that patients categorized as level 1 and 2 are to quarantine at home, while level 3 through 5 are at designated hospitals and quarantine centers.
Those under 60 without such risk as diabetes or high blood pressure are categorized as level 1 or 2. These minor patients can quarantine at home for recovery. Those 60 and over, even if they don't have risk, might suddenly have severe symptoms like difficulty breathing. They are likely to suffer from breathing problems, but do not notice and end up measuring at a low oxygen level of 95. So they are all required to stay at quarantine centers.
The confirmed patients must adhere to strict home quarantine measures set by the Ministry of Health and Welfare. Those who live in the same household as a confirmed patient must reduce contact and also adhere to the rules to protect themselves.
Confirmed patients cannot cook the food. They can only receive meals at the door. The family must leave the door area before the patient can come to pick up their meal. Doing the laundry for the confirmed patients must be done by wearing a mask and gloves, and the clothes must be washed separately.
Dr. Go reminds home quarantine patients and their families to exercise caution, as if the patient experiences more severe symptoms, they must immediately go to the hospital or clinic.
For example, if they have had a fever for 3 days and it won't break, or when they walk, they're out of breath, or if their heart or chest hurts, or can't hold down food, nor care about what's going on. When you ask them questions and they don't really give an answer, then they are lacking oxygen. If it's children, symptoms may look like not eating, or they can eat and immediately vomit. For babies, if you see the breathing to be hard breathing, like their chest caves in, and the muscles on their neck are strained, or sounds of wheezing are present, those are all dangerous signs.
In order to monitor those quarantined at home better, the government set up an evaluation center for COVID-19. Home quarantine patients must report their daily health condition, so the Ministry of Health and Welfare has a better grasp on the situation. And if need be, they will send out an ambulance to take the patient to the hospital or quarantine center for treatment.